Welcome to Ultrasound. My name is Myrna, and I'm privileged to be part of your healthcare. You are fortunate to have in-house ultrasound here at Dr. Wilson and Associates, where we provide same-day exams to evaluate your pelvic organs. Ultrasound is a safe and accurate way to visualize the cervix, uterus, endometrium, and ovaries using high-frequency ultrasonic sound waves. No radiation is used with ultrasound, and generally patients experience minimal discomfort. The exam should last no longer than 10 minutes, and the doctors will have results available typically same day of service. There are many indications for a pelvic ultrasound, including, but not limited to, pelvic pain, bloating, back pain, irregular bleeding, postmenopausal bleeding or spotting, personal or family history of breast cancer, ovarian cancer, or uterine cancer, history of fibroids, history of ovarian cysts, history of a thickened endometrium, amenorrhea or the lack of menses, IUD evaluation or placement, for the confirmation of pregnancy, as a part of pregnancy planning, and as a part of hormone replacement therapy. During your exam, we will evaluate the size, shape, and position of the uterus, evaluate the thickness and echotexture of the endometrial lining, evaluate the size, follicle count, and presence of cysts in the ovaries, and evaluate the pelvic adnexa for masses or free fluid. How to prepare for your ultrasound. In our office, we predominantly perform transvaginal ultrasound. In this procedure, a wand-shaped transducer, or camera, covered in a sheath is inserted into the vaginal canal. Although you may experience some pressure similar to a supersized tampon, the exam should not be painful. As we evaluate the pelvic cavity, it will be necessary to move the camera and apply pressure to best image the pelvic organs. For a transvaginal ultrasound, the only preparation necessary is that you empty your bladder prior to the exam. The exam may be performed at any time throughout your cycle, so there is no reason to schedule around menses unless instructed by one of our doctors. In the case of fertility screenings, the doctor may request specific day of cycle ultrasounds. If a transabdominal ultrasound is indicated in the case of stenosis or for virginal patients, a full bladder is required for best results. Please drink 32 ounces of water at least 1 hour prior to your exam and hold it. We will use that fluid in your bladder as a window to view the pelvic organs. What to expect during your ultrasound. With a transvaginal ultrasound, when you arrive for your ultrasound, you'll be asked to empty your bladder. After undressing from the waist down, you'll be asked to lie down on the exam table while your feet and legs are supported, just as they would be for a pelvic exam. The long, thin transducer camera covered with a latex sheath will be lubricated with gel and gently inserted into the vaginal canal. This may be uncomfortable. If you have a latex allergy, please let us know so we can use a latex-free option. As we evaluate the pelvic organs, it will be necessary to move the camera by turning, angling, and applying pressure with the transducer. Again, you may experience pressure and discomfort, but it should not be painful. If you are having a transabdominal ultrasound, please prep before the exam by drinking 32 ounces of water at least 1 hour prior to exam. When you arrive, you'll be brought back to ultrasound where you will be asked to lie down on the exam table. Ultrasound gel will be applied to the surface of your skin at the level just below the umbilicus. The transducer camera will be placed on the surface of your skin, and we will move the camera by turning, angling, and applying pressure to optimize image quality. If your bladder is not full enough, you may be asked to return to the lobby and drink more water before resuming the exam. Results. Your images will be reviewed by our physicians on the same day as your exam. If you are meeting with the doctor immediately following your ultrasound, she will go over the results with you. If you have your ultrasound after your exam or come in solely for an ultrasound appointment, you can expect your results within 24 hours. Quick note about annual exams. If we have identified a sonographic abnormality on an ultrasound, it is important that we follow it with interval ultrasounds at your annual exam. Abnormalities can include, but are not limited to, uterine fibroids, ovarian cysts, endometrial polyps, and a thickened endometrium. A quick note about hormone replacement therapy. Prior to beginning hormone replacement therapy, all patients will receive a baseline ultrasound. With the introduction of progesterone, there may be changes, and that baseline ultrasound will allow for comparison. Thank you for allowing me to take part in your continued care. I'm so thankful that we are able to provide in-house, same-day ultrasounds where we can quickly and accurately diagnose your symptoms and provide you with a plan for your continued care.